So we are hearing just incredible stories from people right across the country as they recover from coronavirus, the pain and the anguish that it causes. And we're going to introduce you to a couple from Barrie, Ontario in just a second. You're going to meet Rene, who contracted COVID-19 earlier this month. His wife and his 3 children did not, in fact, but it was a very nearly a near-death situation for Rene. And here is what his wife, Tracy, how she portrayed it as she sent out a number of posts on social media. So let's watch this a little bit together first.
Our family has been living a nightmare. Just be strong and have faith. And today I can come and share a success story and tell you that Rene is out of ICU.
He is out of ICU. That's Tracy Segura. So Tracy and Rene Segura, both of whom are with us this morning. There's Tracy at home in Barrie. Good morning, Tracy.
Good morning.
And I wish you could see him with me, but I can introduce him to everybody across Canada. Here's Rene in his hospital bed, but able to speak to us from Royal Victoria Regional Health Centre in Barrie. Hi, Rene.
Hi everyone, how you doing?
Listen, I want to be really careful with you, Rene, because I know you're still recovering, and I know the breathing is not so easy. But I'm going to start with you, and you tell me if you're tuckered out, if it's too much. How are you doing this morning? Okay, Rene, let's start there. How are you doing?
Well, I'm feeling fantastic. I can't praise the RVH team with the care that they've been giving me. I feel fantastic. Every day it's a challenge, but, while we put our foot forward and keep going. So I feel great.
Every day's a challenge, but every day must be a gift. And I bet to you, Tracy, hearing that he's feeling great is about, you might not have imagined it just a couple of days ago. We heard you post on social media that it's been a nightmare. What's it like to hear your husband say that he's feeling okay?
I think this whole experience has emotions and feelings that I've been feeling that I cannot describe. I've never felt this kind of happiness. There was a point where I didn't even think I was going to see him again, and doctors couldn't give me a straight answer. So hearing his voice and seeing him, he thinks he doesn't look that great right now, but I think he looks fantastic.
We think you look great, Rene.
I couldn't be happier to see him right now.
Rene, just take a breath, because I'm going to get Tracy to tell the story. And I was telling them off camera, both of them, that this is a documentary in the making. But Rene got sick just about 2 weeks ago, started feeling sort of a shortness of breath. And initially it was thought it was a cold, and they sent Rene home. And then so Friday, it would be 2 weeks ago Friday, when he was feeling worse, Tracy, you pushed him to go to the hospital. So let's pick up the story when you said we've got to go to the hospital, and then what happened.
Yeah, so like you said, the day before we did take him to the assessment clinic, and they assessed him as a cold. And I just didn't sit well with me. And after discussing it with family members and just kind of noting that he was showing signs of confusion, we thought, we got to get a second opinion. So Thursday morning, I said, you know what, I don't care if we've got to go to the hospital to hear and sit for 5 hours to hear a doctor tell you that you have a cold. I said, you're going to make me feel a lot better, so we're going. And we went, and I think what shocked me was when I got to the emergency door, there was a little team inside the lobby that asked us our symptoms, and because I had none, they told me I couldn't go in with him. He had panic attacks putting the mask on. He was pale. He was having trouble breathing and walking. So I didn't want to leave him, but I had to, and it was the most painful thing to do was to watch him. Well, it took about 25 minutes to get him to agree to go in, first of all, but it was terrible having to watch him walk in on his own, and I couldn't be there for him. So it was hard.
So just a second. So you couldn't go in, so you had this 20-minute conversation about whether he was going to go in, and then he had to turn and go into the hospital himself. Rene, we just heard what Tracy said. Watching you was so difficult. What was it like for you having to go in and face this unknown on your own?
Well, for me, it was a scary moment, right? Because one, it's that unknown is that you might have it, you might have another issue, and not to have your best friend with you, it's tough. So, but as soon as I got in there, the nurses at ER they took charge, calmed me down, and said, just relax. We're going to get through this. And
And you have.
I stayed calm.
And you
Yeah.
have. Again, I'm just going to pause and let you take your breath, and I'll go back to Tracy too. I make sure that I'm not too tiring for you, Renee. But before it's gotten better, I mean, it got a whole lot worse and quickly. He went on life support the following day. They had to intubate him, and again, you're not there. You're having conversations with the nurse, and what did they tell you, Tracy?
I had several conversations with nurses. My sister and I, she's an ICU nurse too, so I had her on the line with me each time I called. We kept calling trauma. Not very often. I knew they were busy, but just to check in on him. And every time we'd hear something good, but then we'd hear nurses say, he's really bad. He's really bad for somebody this age with this level of pneumonia. He's really bad. And I didn't want to believe it was the COVID virus. I wanted to hang on that assessment doctor was right that he didn't have it, but everybody assumed that he did, and they treated him as though he was a COVID patient, and they took all the necessary precautions and jumped ahead and intubated him, and they saved his life.
Did you think at any point you were going to lose him?
Yes, I did. I asked the doctors a couple times. I said, am I going to see my husband again? And they said, just hang on to the fact that he's young and he doesn't have any underlying health issues. But we can't give you a firm answer right now. And that's all I got.
42.
And then because I couldn't be there, I thought, is that it? Is that the last time that I'm going to see my husband? So it was definitely a nightmare.
That's just the extra heartbreak as we've heard these stories of families losing people to this virus is you can't be there with your loved ones as they pass away, and what an extra burden that is, and how much that must increase the pain. Renee, tell us a little bit about, were you aware of just how quickly your health was deteriorating and how bad it was getting for you, and what that experience was like?
Yeah. Every a couple hours I would get changed the amount of air that I needed, just how many nurses were coming in, just everything just started getting scary. But I held on to my faith that I'm going to get through this, because at the end of this, I have my wife and I got 3 kids that I got to get home to. So my focus was on them, and I had to listen to the doctors. I guess the last stage for me was when they said they were going to incubate me, and being alone. That was probably a tough one.
It was a tough one. I bet it was a tough one. But as you said, you held on, and they brought you through. The team there at the hospital in Barrie, and they were able to take you off the. They were able to remove the tube and remove you from life support on Tuesday. So just about 1 week ago, and the recovery continues. Are they telling you anything, Renee, about? Obviously, you're still needing a lot of medical attention there as we see you there in the hospital. But in terms of what this is going to do in terms of long term to your lungs or your health.
I don't think we've
right
been
now,
there yet.
yeah, right now it's just recovery.
Right.
Like they said, I'm going to be coughing for at least 6 weeks, just because of the pneumonia. But it's just one day at a time.
And Renee, and Tracy, I'll come back to you in just a second, but as I'm struck looking at you as this young, lovely couple, Renee, you're 42, and as Tracy just said, no underlying medical conditions. If there is an image, it's that this might be something that affects the elderly more frequently, and you're exactly not that. I'm wondering what you would like us to know about somebody in full blush of health and youth, and being brought to, a near-death experience by this.
I just like to tell everyone that, if you're in good health, stay positive. Stay positive, stay in your faith. Just know that you're going to get through it. depending on what hospital you're in, you know what? They are the best. You're in good hands. The doctors in Canada, the nurses, ICU nurses are probably the most compassionate and amazing. You know, even in the room that I'm in right now, which is more for people that have problems with breathing right now. You know, like they've been fantastic, just helping me out and getting through things. So just stay positive, and put your focus on getting home.
Just pause there if I could, Renee. A couple of quick questions to you, Tracy, as we wrap up. As I listen to Renee's message for those about who this can affect, we do talk from time to time, and we hear from people who just don't think this is a very big deal, this coronavirus, that it's just, you know, sort of like getting...
You're looking right at her. I was just saying a few weeks ago, I said, you know what, we have the news running in our cafe all the time, and I thought, you know what, it's all negative news all the time. There's no success stories, and I thought, I think they're just blowing it up bigger than what it is.
And
I honestly would say that, and because I just thought, I feel terrible for even thinking that before, but there's a lot of people that do think it's being blown up. It's out of this being blown up, but after living through it, we have not traveled. We go to work, we come home, we go to the grocery store, we don't go anywhere, and we have not traveled since last year. So, you know, you don't have to be a traveler to pick this up.
So what do you say to the people who don't take it seriously and aren't doing the proper things that the health officials are telling us to do?
I'm going to say to those people, it's real. Don't be afraid. There are people out there that are yelling at other people to back away, and they're nervous and they're scared. But you know what? We don't have to be scared. We just have to do what's right, and we need to keep our distance. We need to use our hand sanitizers. We need to listen to the instructions being given by our government and the news, and just follow it. Just follow it. You never know where you can pick this up, and it could be this. You don't know, so always make sure you're doing your due diligence, right? And you're gonna be safe. And hey, self-isolation is not bad. Self-isolation. Our whole family has been in self-isolation in different houses, and it is the strongest, absolute strongest my family has ever been.
Isn't that amazing, that connection?
Oh,
well,
yeah.
you're coming together because you have to will Rene back to good health, and thankfully we are seeing that he's on the way back. A couple of, just before I let you go for today, I want you mentioned your cafe, Tracy, and really so much about your life story and your family story is what the many aspects of this coronavirus pandemic people in Canada are facing, not just the health challenges, but what this is doing to your family business and the coffee shop that the two of you run. So we're going to bring you back tomorrow to talk about how you're dealing with that part of the story, as long as Renee's still feeling up to it. So we'll hook up again tomorrow. But Renee, before you're talking to each other, you haven't seen each other. Are they telling you, Renee or Tracy, Renee, and when you might see each other, your beautiful wife, when you might get to be able to actually hold her after getting through all of this?
Nope.
Oh,
I can't wait.
Hopefully, I get some news today. Maybe tomorrow, but whatever the doctors decide at this point. But yes, I'm eager to see her, hold her, kiss her. It's been since March 20th that I last saw her face. So.
Well, I can tell it to you, she has a beautiful smile on that face right now as she talks to you and to us, and I'll look forward to talking to you both tomorrow. Thank you so much for sharing your story with us this morning.
And before I go, can I just say one more thing, please?
Sure.
I just want to say that God is good, and that our faith has been tested and our faith has grown, and that through this entire time, no matter what went on, I had to keep hold of that voice inside me that said he's going to be okay, God's voice. And through the strength that he gave my family, my brother-in-law, my sister, just to hold me up so that I could get through this. I couldn't have gotten through it without love and prayers and everything else. So thank you to everybody that reached out to our family, and thank you for everyone's support. Renee and I are truly grateful for everything. Thank
Beautiful. You know, many people are finding comfort in faith, and there's actually an interfaith national prayer this afternoon that I'm going to talk about in the next hour. So you've just also touched on that, and we'll explore that a little bit further. I look forward to speaking to you both tomorrow, but thank you very much for this first part of our conversation. See you then, Tracy. See you, Renee. You be well today. We'll check back in tomorrow, okay?
Thank you.
The
Take care.
Seguras in Barrie, Ontario.